Hey everybody, welcome back. So I think what we're going to do today is split up the personality assessment chapter into probably two parts. One of them is going to be the objective test. Another one is going to be the subjective test. Now, there isn't really a reason for doing that except for to try and make this a little bit shorter on you, or at least split it up if it's going to be longer. So I'll still try and keep it down to an hour, but we'll see how we do as we go along here. So first of all, what the heck are personality tests even for? Why would we use them? You guys probably have taken one before and you may not have even noticed it was a personality test, but here's a kind of just a general list of why would these things be used in practice. One of them is for employment settings to aid in personnel selection. So as a rehabilitation counselor, this kind of harkens way back to the early days of Frank Parsons. And Parsons was he hired or told or appointed somehow to help figure out if we have all these people who are being either drafted into the military or they're choosing to go into the military, we got to figure out a way to decide where they're going to go. Like, is this guy fit to be a tank mechanic, or is this guy fit to be an intelligence officer? How do you tell? Because those are kind of different jobs, right? So he started this process of differentiating how to choose certain kinds of people. Now, we have more career personality inventories that we're going to go over in a couple weeks, but we'll save that for now. Another setting, more contemporary, in like the workplace settings, another kind of testing that's done now in the workplace settings is not so much what kind of skills do you have and does it apply to that kind of work. It's more about, do you have the right kind of personality characteristics to fit our team? And I've heard students say this too, and I tell the story about how when I was like 20-something, I drove out to North Carolina to go live and just kind of be out there after I graduated. And one of the first things I did was I went to Applebee's and I sat down and I said, okay, I have kitchen experience, because I did. And I'm wondering if you are hiring. And he slid this paper across the table in very like negotiation style. And he's like, here, if you take this, I'll be back in a few minutes when you're done and we'll see how it goes. And so I took this personality test. He took it back to his office, scored it, came back and said, I don't think it's going to work out. And I just left and I was like, did I pass? He's like, no. So I didn't know what that was all about. I think what it was is they wanted to know if I was the kind of guy who could take direction. And apparently I'm not, I guess. I don't know. But anyway, that's just an example of how those can be used, because people want to find certain kind of attributes that will fit their workplace, something like that. In forensic settings to aid identification of problematic behavior patterns. So this is everything from, I don't know, like parenting fitness for child custody cases. Is the parent do they have the kind of personality traits that fit? It's not just about parenting skills, but the kind of personality, well, this is, I guess, a bad example, but here's a better one. Think about those insanity trials on Hollywood movies where they're like, is this person clinically insane, or is he sane enough to know what he was doing at the time of the crime, or something like that? We'll talk about one of the tests that's used for that kind of thing specifically. The term psychopathic diagnosis, it sounds like a heavy term, but basically that just means anything that goes on in the mind. That's the psycho part. Pathic means disorder, so any mental disorder, diagnosing that. So anything that's in the DSM, that's personality tests can be used for something like that, and I'll show you examples of that later too. Clinical settings to evaluate growth and change behavior. We've talked about those in multiple different ways, but that's just kind of like someone comes in, you get a baseline evaluation, and then you get, later on, you can see how they're doing. Part of the challenge with understanding personality inventories, because there's so many different kinds, is some of them are designed specifically to identify pathology related to personality characteristics. So they're used for clinical purposes in terms of diagnosis. Other ones, like for example, the Myers-Briggs, it's not going to tell you about pathology, it's just going to tell you your personal type. So because there's these two different things, sometimes we talk about personality tests in this big lump, but they can be used for so many different things, which is why you might be like, well, if one is for diagnosis, how does the Myers-Briggs fit that? And to be honest, I don't think it does. It just tells you the type, and there's neither good nor bad. They're both, like if I'm an introvert or an extrovert, it doesn't matter. They're both okay to be that way. However, some personality tests show pathology, show clinical impairment or something like that. So something to keep in mind. One of the ones that I added to the list that wasn't in the textbook is underlying typological tendencies. It's just a kind of a mouthful of words. What the heck does that even mean? Underlying typological tendencies has to do with the way that I think about our counseling process. So it's one thing for a person to come in and you say, okay, I've done an assessment, I've adequately evaluated what symptoms have led to which diagnoses, and we get that part, and that's cool, right? But some people are like, part of my depression relates to the way I relate interpersonally, and that comes from the way that I learned to relate to people socially as a child, or relate to my primary caregivers, which is kind of related to attachment, maybe if there's some ACE score stuff like trauma or adverse childhood experiences, maybe there's some of that going on. And so what we're doing in that case is we're saying, yeah, we've assessed the diagnostic condition, and it's related to typological stuff that was learned in early age, which means that we get to kind of peel back the layers of, well, how has that developed your personality? Just for sake of example, let's say somebody learned to withdraw from their parents when their parents got angry or something. And so instead of like being an introverted kind of person, they actually really like people, but they're just kind of scared. And so if we can understand their typology and say, at your best, when you're healthy, you love people and you love to be around them, which kind of shows these extrovert tendencies. But if you learned to withdraw from people because of some traumatic situation, big T or little t doesn't really matter, like a big event or just, these little tiny like death by 1,000 cuts kind of thing, where you just learn to withdraw from your parents, that's an underlying typological tendency that we might get at. And that's just one example of many. So whenever you're doing an assessment and you're asking about childhood and parent relations and how that's then affecting a person's adult life, that's the kind of stuff we're talking about. So there's a lot to unpack there, but we'll just leave that one there for now. A couple more that I'll just kind of briefly go through is career counseling, choosing a good fitting career, which again, we'll come back to this when we talk about John Holland and Donald Super and how those kind of relate to career evaluation and stuff. Clinical counseling, of course, we've already talked about that one. School counseling, help determining difficulties in academics. So this might be, again, like, why does my teacher treat me this way? Well, this is the way you are, this is the way they are. Which parts are dysfunctional, which parts make sense, something like that could happen. Employment counseling, the way that this is different maybe from career counseling, it's not sort of like finding and developing a career, but a lot of us have done this where we've been working at a place and they sit everybody down and they say, well, Janice from accounting is an ISTJ on the Myers-Briggs, and I'm a social guy, I'm an ENFP, so how are we different? Let's work it out so we can understand each other a little better. That's what I'm talking about when I talk about employment counseling. And then neuropsychology, determining cognitive and behavioral affect after something like a brain injury. That could be something to know. In fact, in Psych 101 classes, when you talk about personality, one of the first cases that gets brought up is the case of Phineas Cage, who was he was a railroad worker, and he got the pole thing blew up and it went through his frontal lobe, and then his personality, quote unquote, kind of changed because he was kind of like a seemingly happy average guy, whatever, and then he became grumpy and behavioral. And so the question about what is personality then is part of that discussion. So let's go there. What the heck is personality? Here's a definition for it. But let's start down at the bottom here. I think that might help. And hopefully this is not cut off too much. I think my screen cuts off a little bit at the bottom of the slides. But when we think about things like feelings are something that they drive our behavior. They kind of make up who we are. They're part of us as people and part of our psychological experience. But feelings are kind of fleeting, right? Like maybe they last for, I don't know, a couple minutes, but feelings can change from moment to moment based on hormones, based on interactions, based on all kinds of stuff, right? So feelings are something that maybe last, I don't know, I'm just arbitrarily throwing this out, but they can last for seconds up to maybe minutes, maybe an hour, but typically they're not, feelings typically don't last that long, I guess. Moods, however, they're also part of our feelings and part of our personality, part of us, but they just last a little bit longer. So there's kind of this progression. I'm just kind of picking these words out arbitrarily. There could be other ones and we could split hairs about these, but the idea is that feelings are kind of fleeting. Moods last a little bit longer, so they're more stable, you could say. When it comes to personality, personality is something that really doesn't change from minute to minute, or hour to hour, or day to day, or even year to year. Usually personality is something that's stable and consistent over the course of a lifetime. Now, if you've ever taken personality tests and then you've done it again, sometimes you get different results. So some of that maybe could change, and that's kind of part of the conversation here. But now let's jump back up to the top. A personality is a stable and consistent trait. So stable and consistent traits are a cluster of traits that are expressed over a long period of time, but not unchanging, because they can change, right? Like there's some parts of us that we can move from being introvert to extrovert, from sensing to judging, just taking from Myers-Briggs language here. Or sometimes our personality is consistent and stable, but when we're unhealthy, it's expressed in different ways, or when we're healthy, it looks a little bit different. So these are all parts of the conversation, but ideally it lasts longer. That's kind of the idea. This brings up conversations about this whole nature-nurture debate, and I pulled this quote out of the book because I thought it was interesting. So part of this debate is whether your personality is developed by your interactions and attachment experiences early in life, or whether there's like a genetic component. You talk to any mom and they're like, I could see the personality characteristics in my baby that I now see as a 10-year-old or something like that. So it kind of seems like there's something genetic here that is just ingrained in our DNA, and other things are environmentally learned. But let me read this quote here quick. If you view personality as stable as a stable and unchanging collection of behaviors tied only to genetic predispositions, then you are likely to see some clients as hopeless. On the other hand, I'll explain this in a second. On the other hand, if you see personality as a combination of genetics and environmental or social learning, then you might see opportunities for clients to manage behaviors that have been ingrained or even change long-lasting behavior patterns. So what that means is that if everything is just genetic and it's predisposed, then people are going to be the way they are, and there's really no hope for improvement or change as they get older. Like if someone was born a serial killer, they're going to be a serial killer. But in the counseling process, we have to see the environmental influence, and I think for most of us that makes sense. However, in the scheme of history, there's been this conversation of, is it genetic or is it environment or is it both? Of course, we probably know it's both today, but that's not been the case always. We know that there are things called adverse childhood experiences, and they affect us, not only our mental life and our inner psyche or whatever, but also our physical life, meaning if we have traumatic experiences, that floods our body with cortisol hormones, and it activates our nervous system, which means that then we act in this fight or flight kind of way, which leads to withdraw or fight symptoms, either one, maybe freeze too, who knows. And that then affects the way we behave and the way we think. So all of those things are interconnected, and they're related to environment and genetics. How much? Who knows? That's part of the debate. We're not going to go into the debate too much, but it is good to know that there are these conversations to have, because some assessments are built on different foundations, and I'll explain a little more about that too. This is a slide that I don't want to spend a whole ton of time on, but when I mention things like how a test is developed and which foundation it's based on, here are a couple examples. So the rational approach, or using deductive logic to determine which personality elements relate. In other words, think like Carl Jung's archetypes. If somebody, if I were to go back in history and read a bunch of books and explore a bunch of different cultures and sort of do this anthropological study of all these different people over time and over space, geography, I might be able to look and say, it seems like there's this consistent pattern between these type of people. There's the warriors and the healers and like that kind of thing, which there is something legitimate to that, I think, and we'll talk about the Enneagram in a little bit. It's not scientifically founded. It's founded this like deductive logic kind of approach. Then there's theory-based tests. So when we get to the projective test, we'll talk about stuff like this. If we believe that there is something called a subconscious or even preconscious, and we only have access to our conscious, then we can make a test like, say, the Rorschach inkblot test. If we ask somebody, what do you see in that picture? Or some exercise that we do as children sometimes, what do you see in that cloud? Is it a puppy or is it a dragon, or what does it look like? And one kid says, oh, it looks like a puppy. And the next kid says, it looks like a severed head. The idea is that there's an underlying subconscious repressed something that we can then pick up out of that comment, out of that severed head comment, and we can say there's something down there that's worth attending to. So that's the idea about a projective test based on the theory of psychoanalysis and the preconscious idea subconscious. That's just an example. The criterion group approach. This one I don't want to explain a whole bunch, but it's a little bit similar to the factor analysis. Well, no, it's not, I guess. It's a little bit different. So using experimental designs. In other words, that we can use science and the methods of science to break things apart a little bit differently. Factor analysis is more like using statistics and numbers to really break things down from a large amount of information to small categories. I don't want to talk too much about those, but the combined approach, there can be, you can combine these different things. So if you have a projective test based on theory and then you start collecting data, and then you want to break it up into criterion, you say, well, men act this way and women act this way. So it seems like they have different inner experiences or something. I don't know if that's even a thing, but something like that could happen. Okay, but let's start talking about some specific objective tests. The first and foremost one that you should probably know, and you'll find this on like your NCE test, this is one that you want to know the name of and know what it's for. For counselors with master's degrees, you're probably not going to be spending a ton of time administering and interpreting this unless you get special training and extra supervision in this, because this is a complicated test. It does a whole bunch of really powerful things. So let me explain that first, and we can talk more about why it's so complicated. The purpose of the Minnesota Multifaceted Personality Inventory, or MMPI, is to diagnose pathology. It doesn't mean diagnose it in like a DSM-5 kind of way. It means anything that could be wrong with the human experience, it's supposed to find it. That sounds like a pretty grumpy kind of test, but it does a lot of wonderful and interesting things. And it's not just to be like addressing psychopathology. It gives us the opportunity to understand who a person is and also where those parts are kind of going awry. It's hard to explain that without showing you an example, and I can't show an example in this platform, but if you want to watch the class recording, I do go over some of those, some of the, I don't know, the examples of MMPI results, something like that. For those of you watching this online, I record my class lectures too, and I show additional things in class to the people who are students here. But anyway, so these tests can be very complicated. Some versions of the test have like 567 questions. Others have less, but they take hours to administer. They take a while to score, depending on if you're doing it via computer or paper pencil. The paper pencil takes a little bit of time to score. Computers are obviously faster, but there's so much that goes into it to understand. And the test doesn't stand alone. You also have to do like an interview and understand a person's comments based on what you see in the testing results and that kind of stuff. So it's just a really complicated test. And if you look at the subscales of it, you have the MMPI, then you have these different categories, and within the categories, there's different subscales. And so there's just tons of information that you can draw out of this stuff. And it's super fascinating. For those of you in the class, I strongly encourage you to go watch the class recording and see kind of the breakdown of what those look like. And there's examples in your portal too. There's examples of validity subscales. And this is one of the things that makes this test so powerful, is that you can learn a lot about a person's motivations. What I mean by that is when somebody comes in and takes the PHQ-9 at your local doctor's office, and they're like, I know I have to hand this clipboard over the counter to the receptionist, and I want the doctor to see it, but I'm also nervous about what she's going to think about me. So I'm going to like kind of write down that, no, I haven't had suicidal ideations, even if I maybe did. And yeah, I'm not gaining weight, but I really actually kind of am. Or just examples like this. You can cheat the system. You can lie to it, and it can't really find that out. The only way you can find that out is by talking to the person and like learning about their motivations and that kind of stuff. Tests like this and other ones too they can learn a little bit about, are you really being honest? Do you have ulterior motives for trying to maybe look like you're better than you actually are, or look like you're worse than you actually are? These tests can draw that stuff out. If you've ever taken a test before and you had one question, question 5 was like, do you like warm weather? And then question 47 was, do you like weather that's not cold? And you're like, isn't that asking the same dang thing, but just like slightly worded slightly different? Yeah, and that's on purpose. Partly because it can do things like, say, if you answered, yes, I like warm weather, and I answered, no, I like warm weather, that's kind of saying the same thing. But if you answered yes for one and no for the other, or yes for both, and so there's contradictory results, then it might be suspecting that, hey, maybe they're just filling this thing out and they're not actually reading the questions, or maybe they're really confused, or maybe they're trying to give the impression of something. These tests are very, very well designed to do that kind of thing, to draw out, are you being honest? And sometimes that can be, sometimes they're called lie scales. I don't like that term because people aren't always lying. Sometimes we're intentionally lying. Sometimes we're subconsciously trying to make a better impression than we think we are, just like trying to look good. In other words, we're coping with life because it's hard sometimes. So lie scales doesn't totally capture it, but validity kind of can, because in the class, the example we show is the MMPI was given to a person who's been dealing with lots of medical issues and has lots of physical pain and some food allergies that are pretty strong, or affect her life quite a bit. And as a result of that, she just has to put on her survivor hat, and she's like, life is hard, I'm constantly in pain, but I'm going to keep going, and I'm going to put my smile on. And you're like, fake it till you make it, but you don't have to. It's okay to be not okay. And we have these conversations in class, but she looks like she's okay on the outside, but she's really not. And so she sort of creates this good impression, which looks like she could be lying about how much she's actually hurting, but she's really just doing a good job of coping with the difficulties of life. So that's just an example of the kind of stuff that you can draw out of the validity scales to determine whether a person's being honest or lying, or whether they're coping, or if you're getting good results. There's all kinds of ways you can look at that, but I just want to give a few examples. That's one of the questions people have a lot. And I'm not going to show you the example of the MMPI report because time. There's other ways to go look at it. Here are a few other examples. Now, the million is not the MMPI. The MMPI focuses on clinical symptoms that can lead to a diagnosis. In other words, it can tell you about things like, one of my favorite ones, in fact, I'll go back here and tell you a story real quick. When I was in school, I took the MMPI before I learned to administer it to somebody else. And one of the things I scored relatively high on was psychopathic deviance. And instantly I got my results back and I was like, okay, yeah, right. I don't feel like a deviant. I'm working through the system. I like people. People like me. Things seem fine. Not everybody likes me, but you get the idea. Like I'm not like going out and like starting fires in the bathroom or something. So I asked my professor about this, and I had this reaction too of like, no, this can't be right. This has got to be wrong, which is something your clients will say too. And it's normal for people to get results they just don't like, right? This was me doing that. So I asked him about it, and he said, have you ever had any experiences with the law? And I said, yeah, I had family members in the correctional system. I was kind of I will say, for lack of a better word, troubled child. So people looked at me suspiciously, and I was always kind of like dodging authorities, just basically because I didn't want them to catch on that I was really hurting so much on the inside, which is a whole other story I'll tell some other time. But this is kind of an experience that we have. We have this inner world, and sometimes it's not always feeling great, but we don't really want to trust adults. It's just kind of a normal teenage thing to do. So I moved away from authority. So I've always had this, like, I don't want to be around people who are in charge or who could get me in trouble, something like that. And then, of course, I also did get in trouble sometimes. And so there was part of that, too. And so I was asking him, I was like, does that make me deviant? Because now I don't feel that deviant. So how does this draw out that? Like, what parts of me are sort of rejecting authority figures or something like that? And he said, well, there's also another explanation. Another explanation is that lots of grad students, in fact, many, many grad students, score high on this category, not because they're deviant and they're trying to buck authority, but because they're constantly under pressure from different professors saying they want things different ways, and it always has to be this way and that way, and different expectations. And the student has to say, in order to cope with this environment where there's just this barrage of chaotic expectations upon me, I have to say, you know what, all you authority professors, I just need to sort of tune you out and do it my own way, and I gotta find my own path. I'll try to do my best to hear all your stuff and learn from you, but I also am getting overwhelmed by all these various expectations, which sometimes can be pretty strong. So it's kind of like setting boundaries. Psychopathic deviance sounds like a really strong term, but boundary setting does not. And so this thing captures kind of both of that, but now we've evolved different language and for different purposes. But that's an example of how this can be used for not such, pathological, diagnostic kind of ways. Now contrast that to the million. If the MMPI focuses on clinical symptoms like deviance or coping or whatever that can be used to lead to a diagnosis, the million is specifically designed just to diagnose. It's shorter, there's less questions, and it can be used for, do they have this symptom, which then falls into this diagnostic category, something like that. So you'll see this one used a lot more in the sort of the counseling world, or potentially in the counseling world, whereas the MMPI is used more by psychologists. And the million is, I'm not positive about this, but I'm pretty sure it's a level B test. It's available to all of us. So something worth learning about. Here's a few others. I'm not going to spend a ton of time on these just for the sake of time. But the California Psychological Inventory, that's one that there's also an example in one of the reports you have on D2L. It's also something we go over in class just briefly, so you can check out the class video if you want to see that, because it's pretty interesting. The NEO is another one. There's only a 5-factor model of personality in that one, which means there's not like contrasted with the 16 personality factors. There's not 16 personality factors. It's not like the Myers-Briggs where there's 4 different spectrums, one personality trait on each side, introversion, extroversion. And if you take those, that means there's introvert, extrovert, sensing and judging, intuitive, that kind of stuff. Then there's 24 different personality typologies, basically. The NEO just says there's 5. It has a 5-factor model of personality. Those are broken down a little bit too, but so different kinds of tests for different uses. The idea here is that you don't have to learn all of them, but getting used to one or a couple or as many as you can, you then have more tools to understand the different kinds of people. So that can be helpful, but I don't want to go into that too much. If you've never heard of the Myers-Briggs type indicator, this is something that would be good to get to know because it's a popular one. Even people outside of the counseling world know about this. This is the kind of thing you do in corporate offices or with teams of people to like learn about each other. I was giving an example of like, why is Janice in accounting always like that? And she doesn't want to go out to lunch with us. Does she not like us? Well, no, she just thinks you're overwhelming and she wants to sit by herself and read her book. That's just different personality type or something. Which I laugh because I know people like that, and I'm the kind who wants to go out, and they're like, ugh, just give me some space, dude. I'm like, all right, still like you. Thank you. Anyway, so I'm not going to go too deep into this. I don't want to explain the whole thing, but basically the way it works is you have, these are the, I can't point to that. There is the introversion, extroversion, and it's on a spectrum, and all of us kind of fall somewhere on that. And so once you take the test, it tells you you're an extrovert or an introvert, and ideally it would tell you, are you like a strong extrovert, or on one day could you be an introvert, extrovert the other, that kind of stuff. And then all these other categories too, and that's how you find out your personality type. I turn out to be an ENFP, which is pretty typical of like the counseling, helping professions kind of thing. So that's enough said about that one probably. Here's another one. Oh, I guess the other thing to tell about the Myers-Briggs too, if you don't know this already, I forget the names of the people, Myers and Briggs, but somehow it's like the daughter of Carl Jung was somehow involved in the development of this. So it kind of comes out of that like typological system of Carl Jung's archetypes and that kind of stuff. There's a lot more foundation to this than just someone willy-nilly picking out these 4 things or these 4 spectrums, whatever. So you can go back and read read a textbook and it'll tell you more about the origins of these things if you want to know. The reason I say that is because some of these are founded on scientific research. Like if we use a factor analysis to boil down all these different words that we use to describe people to find out their 16 personality factors, they use math essentially or statistics to do that. The Enneagram was developed in a very different way. Remember earlier when I said Carl Jung did this like anthropological study and looked over the world's culture and the written history of all these different cultural groups? That's kind of how the Enneagram evolved and was developed. These two guys, Riso and Hudson, they sort of established this, but it's been picked up a lot and criticized a lot in nowadays in contemporary culture, mostly because the people who pick it up are sort of new agey, and so the science folks are like, no, that's just new age stuff. That's not real stuff. And so there's a little bit of controversy about this, but I'm going to tell you why I think this is valuable. The reason why I like this one is, in contrast to the Myers-Briggs will tell you what kind of person you are, and then you're kind of on your own to determine, okay, what do I do with this information? There's lots of resources to say you might interact with people this way, whatever. But the thing that's good about the Enneagram is it says, okay, if you're I'm a number 7. If you're number 7, then this is what you look like when you're at your best, and this is what you look like when you're not at your best, or you're healthy and unhealthy. That's the categories I put here. What that looks like for me is, as the enthusiast, I'm a person who likes to be out with people. I like to be working on projects. I'm always kind of interested in new things, and I can be really motivated to just like get out and have new experiences and like adventurous and all that kind of stuff. At my best, that means I like to be involved in a lot of things and try new stuff and learn new activities. So I come across as being accomplished. Some people misunderstand that as being like more intelligent or whatever, but it's just kind of my personality to want to like learn lots of different skills and be a part of different things. I tend to show up as extroverted, and enthusiasts tend to be that way. It's like we want to bring people together and make all kinds of new experiences and learn about all the people, and I want to understand everybody's story and that kind of stuff. On the flip side, if I don't keep that stuff in check, and if I don't keep myself grounded and balanced, all of that energy and excitement and interest can look like just being an egotistical dude who just wants to hear himself talk. I just get excited and I'm like, oh, I want to talk over everybody, and I want to interject in people's conversations, and it can just be like overwhelming to a lot of people, even though my intention is just to like get to know people and have a good time, and I want everything to be okay. So it can just look excessive, and sometimes if taken to extreme, it can be kind of manic. Like I want to do so many things that I can't stop and rest, which is an important part of life, right? Resting, slowing down, and stopping. One of the ways I've heard this described is like this constant case of FOMO, fear of missing out. Like I have to have all the experiences. So what the Enneagram can do is help, depending on what kind of what your number is, it can help you determine and understand yourself better. It's not about diagnosing other people. You don't go to somebody else and be like, oh, you are totally a 4. I know you're a 4 because here's how you are. That's not what's supposed to happen. This is a process of self-discovery. So you can find out, when I do these kind of behaviors, like getting kind of a little bit manic about something or like talking over people, I realize that there's some imbalance that I have to check within myself. And so it can really help, especially as clinicians, it can help identify what are those parts of me that I need to watch out for, and what things can really help me grow and that I can celebrate and appreciate and put energy into. Because then you learn about the different kinds of things you can be good at that way. So anyway, that's enough about the Enneagram, but you don't see this used on assessments a lot. You'll see it used in practice with people to talk to them to learn a little bit more, but it's not something you're going to report to like an insurance company or something like that. There is an example in class of somebody who uses that alongside her clinical stuff, and that's absolutely appropriate for the class, but probably it's just not going to happen in professional reporting. So, okay. This is now getting into the projective stuff. So I'm going to stop the video now. We're at 34 minutes. So I guess we might get through this in an hour. I think I'm going to stop it now and split them up, though, because that gives everybody a break, and you can go do something else and come back to the other part. So I'll be back with you in just a little bit. See ya.